PeriPrem is a unique evidence-based perinatal care bundle designed to improve survival free from brain injury for preterm babies. The goal is to reduce brain injury and death by at least 50%, aligned with the NHS long-term plan. PeriPrem forged a perinatal QI collaborative of 12 trusts, South West and West of England AHSNs, the neonatal ODN and parent partners. Implementation was co-produced by parents with lived experience of preterm birth in partnership with the 12 perinatal teams. PeriPrem created bespoke web-based resources with free and open access for all. This includes the innovative parent-held baby passport. Implementation was independently evaluated and published in BMJ Open Quality. This demonstrated improvements in the proportion of mother and baby dyads receiving the complete bundle from 3 to 29%, and improvements in 10 out of 11 of the bundle elements. Improvements were reported in team function, situation monitoring, and team communication. PeriPrem was highlighted as an exemplar optimization program in the Get It Right First Time and National Child Mortality Database reports. Severe brain injury reduced by 34% and mortality by 22% in the most immature babies following implementation of the care bundle. PeriPrem is transforming the lives of preterm babies and their families and the perinatal teams caring for them.
NHS Education Scotland, the Scottish Cooling Group, Scottish Perinatal Network and the parent charity PEEPS have collaborated on a wide range of resources to support the universal use of AEEG and of servo-cooling. The resources include one national pathway with simple flowcharts, videos developed by product companies, bespoke training days for referring hospitals and trainees, a parent information leaflet and a mechanism for remote consultation. In addition, 3 video animations have been developed to support accurate neurological assessment, parent communication about diagnosis and cooling therapy, and in communicating prognosis following MRI. This is what our stakeholders say.
From an NHS Education for Scotland perspective, this work has been an outstanding example of truly collaborative working to develop educational resources that will directly impact and improve the clinical care for babies with hypoxic ischemic encephalopathy.
As a trainee, I find these resources invaluable. They've helped standardise my approach to the infant at risk of HIE, but have also helped structure my conversations with consultants out of hours when I think that cooling may be appropriate.
The Scottish Cooling Group programme of support has been extremely helpful in our level 2 unit. It has enhanced confidence with the structured assessment of babies at risk of hypoxic encephalopathy and ensured early and therapeutic hypothermia.
For families like mine who've experienced a HIE event, we know that things can't be changed, but it's really important to try and improve things for future families. So it means a lot that the parent voice is being heard.
My name is Nick Hamilton and I'm presenting on behalf of the Butterfly Project, Baby Loss and Multiple Pregnancy for the BAPM GOPI Mellon Awards. The Butterfly Project represents over 15 years research and quality improvement. We conducted a series of in-depth qualitative studies with bereaved parents and the staff who care for them. The focus of the Butterfly Project was on parents suffering the loss of one or more babies from a multiple pregnancy, but where at least one baby survived. We call this co-twin loss. 1 in 5 women suffer a miscarriage, 1 in 200 a stillbirth, and there are around 2,000 neonatal deaths per year, and many of these occur in twins or triplets. Our qualitative studies identified 8 themes, including identity, acknowledgement of the bereavement, support for parents emotionally, the importance of appropriate information, continuity, memory making, logistics, and discharge. We worked with more than 30 families, conducted this research and workshops. We co-developed guidelines and teaching resources, and we developed the butterfly symbol placed on the cot of a surviving sibling or on the notes, and this is now widely used across the NHS and globally. We then conducted a film project with families, created an educational website that has had over 10,000 views worldwide, and our work has been integrated into the SANS National Bereavement Care Pathway. And most recently, we've developed an online course. The butterfly symbol is placed next to the incubator or cot of the surviving baby. And on this, we ask parents to write the name of the baby who died if they wish. Our work has been translated internationally into lots of different languages, and we now partner with a parent-led advocacy organisation, Sky High Foundation, who distribute butterfly cot cards and other resources to NHS hospitals. Being struck by the power of hearing parents speak, we conducted a film project with 8 families and 6 NICU staff and shot over 60 hours of footage. And we were struck by the fact that parents remember for the rest of their lives what staff said and how it made them feel. We created a free-to-access website with video clips and other resources that is widely used to support this in clinical environments. And the downloads include things such as tips for families and friends. The butterfly symbol has been well accepted by parents. We've developed badges that siblings place on their work and school bags, artwork, and some parents have had tattoos. We then developed an online learning course, which was launched at the end of last year. This is accredited for CME, CNE by the Royal College of Paediatrics and Child Health, Royal College of Nurses, the Institute of Health Visiting and the Neonatal Nurses Association, and endorsed by more than 20 advocacy organisations worldwide. The course is made up of a series of steps, which include audio clips, videos, short articles, and also the ability to take part in discussions with other peers from around the world. The course takes around 4 hours to complete. The course is evaluated extremely well, with great feedback from different types of learners taking the course from multidisciplinary settings. And the course currently rates as 4.9 out of 5 stars. The course is relevant to a wide team of people, and we've had over 1,000 learners from 80 different countries enroll, and these facilitate discussions with peers from other settings. The Butterfly Project represents a large multidisciplinary NHS clinical and academic team, and many parents over 15 years, and we're grateful for all the parents, siblings, and families who took part. And most recently, we partnered with a baby loss charity to release a series of podcasts that in which parents suffering and sisters who have suffered the loss of a twin talk about their experiences. Thank you.
We were worried about the welfare of our neonatal unit graduates when the COVID pandemic led to restricted visits to hospital. With the support of our local MP, we partnered with a local authority and community NHS trusts to establish a joint consultant, health visitor, and infant key worker specialist community-based neonatal clinic. This digitally enabled clinic at the Children's Centre starts with an online discussion between parents and the team to introduce families to services for supporting child development and address common problems of the newborn. A face-to-face consultation enables a tailored review of individual needs. These pictures show an infant key worker assessing a neonatal unit graduate and a consultant and a health visitor conducting an in-person consultation. This clinic has enabled prompt referral of babies to a range of community-based services, breastfeeding support, baby classes, immunization catch-up, and even connecting families to an asylum support service. All parents who attended fed back that they felt safe. Moving on, we will facilitate closer integration of the children's centres with our neonatal unit. We will introduce group sessions for appropriate babies, increase the expertise available at the clinics, and realise our ambition to make this model the default services for all our neonatal unit graduates.